KwaZulu-Natal Premier Sihle Zikala is giving an update on the coronavirus situation in the province. He's already started to speak at this time. Let's take you there now.
With regard to mass gatherings, it has also come to our attention that despite the restriction on mass gatherings still being in place, some people have started congregating in large numbers to participate in family feasts, parties, and religious gatherings. This failure to heed of the regulation could have serious consequences and will not be tolerated. Our law enforcement agencies will upscale effort to monitor compliance with level 3 regulations with effect from tomorrow. We're going to tighten this. We want to say that there is no time or space for despair. Although indications are that COVID-19 is intensifying its prevalence, now it's not time to despair or lose hope, but rather a time to double up our effort and intensify our adherence to the safety precautions. These include wearing a face mask when venturing out in public, practicing social distancing of at least 1.5 meters, wash hands with soap and water for at least 20 seconds, cover our mouth and nose with a flexed elbow when coughing or sneezing. It is in the hands of each and every one of us to cap the infection rate and to move all of us closer to a COVID-free era. As we start the Men's Month, the start of July signifies the start of Men's Month, which places the focus squarely on the role and the behavior of men in society. We will continue with our efforts to reduce and ultimately eradicate the scourge of gender-based violence, which has continued to afflict us in the recent weeks. We would want to encourage all men to play a role. We must all say not in our name. We must all be protectors of mothers and girls. We must all teach our boys to behave themselves and to respect women and girls. With that, we wish to thank all of you for being with us today.
Thank you very much, Honorable Premier. Without any further delay, we'll quickly take the questions, and we already have some that have been asked via the social media platform. Can I get an indication of that from the colleagues here? I see you, Carita. Another Commander. Okay, let's start with the two colleagues, and I will add the others. Over to you, Helen. Press the mic, the one next to you.
Can you please get your comments with regards to the tackle KZN which wants to operate their vehicles fully tomorrow despite lockdown regulations which hold for certain comments? And then with regards to gender-based violence, Premier, yesterday we did see several protesters at the Durban beachfront. They did not have comments to gather, but they want to know from the KZN government again what programs are implemented going forward. We're not seeing action on the ground community workers with programs. What is something?
Okay, thank you. Commander?
ENCA Premier, just mine is related to what my colleague Karinda has asked, but basically with Sanchakwa threatening to load full capacity from tomorrow, in your statement you have just mentioned that you are concerned about public transport and the spread of COVID-19. Are you worried that should they go ahead with their threat to load full capacity, that will make the situation worse? But also, number two, on the issue of schools reopening and other grades coming back, you have just given us some statistics here. It's clear that the numbers are set to increase. Are you worried about that possibility that when other grades come back on the 6th of July in KwaZulu-Natal, we are likely to see more cases of COVID-19 for both teachers and pupils? Unfortunately, the leader of government business is not here, but since you touched on the issue of the economy, with the hospitality industry reopening as from tomorrow or as of Monday, what are you going to do to ensure compliance? Because during the level 5 of the lockdown, we saw some business entities in KwaZulu-Natal not adhering to the regulations. Is there a case of COVID-19 in your office, Premier? Number two, when it comes to the Department of Health, can you talk to us about Nkosi Albert Lutuli? If you can, how many confirmed cases of COVID-19 in Nkosi Albert Lutuli? Because based on the report from the Mercury, there are more than 30. Thank you very much.
Thank you very much. Karinda, you want to have a second one?
Yes, question for the health ministry. Gender Commission Africa, can you give us an update with regards to ventilators that are available for our province ahead of the
Okay, I think that ties up with the one that came from the daily news about the increase in the number of cases. I think also Albert Hospital. Does the MEC have an idea how the numbers managed to increase this much in the hospital? So, but we'll hand over to the respond and then
No, good afternoon, ladies and gentlemen. Thank you very much for the questions. Let me start with the question. I think it's a simpler question on how many ventilators do we have in the province, and I'm sure you are aware that as a department we have been working very hard on increasing our capacity, both in relation to ICU beds, but also your isolation and quarantine beds. Now, as a province and as government, we have just about 200 ventilators in the province. There are other ventilators that are available in the private sector, and that number also goes to about the same. However, we as the government have also ordered new ventilators. We've ordered about 100 ventilators on our own. We have been also promised a donation of another 100 ventilators. I must indicate that this order of the 100 ventilators that I'm speaking to was actually issued around March, and we are still waiting today for the delivery of these ventilators. As a result, we have then also agreed with the head of department that he needs to start engaging the Director General at a national level, because we are participating in a contract that is managed at that particular level. Now, the reason why it's only 100 ventilators that we have ordered now, because we ordered in March, our plan was that we'll order in March, and by end of March they deliver the first 100, then we order the second batch. And the fact that they've not delivered then is beginning to eat into that time and that planning that we initially had. The reason why we had also not been very quick in chasing them initially was because we are aware of the challenge of shortages of the equipment that is utilized, not just in South Africa but in the world. But it is beginning to be a challenge to us. So we have decided that we need to escalate the matter. While we agree that the beds that we have, the actual beds that we have would be ICU. I said in the public sector it's about 200. We've also decided that the new reconfigured beds that we have created in the different facilities, some of them can be easily converted into ICU beds should the need arise. So we are going to be utilizing those as we move along, as and when there's a need. So I'm just trying to indicate that while the actual beds that we have physically right now are that number, but there is a plan that says where are we, how are we moving forward, should we be pushed for that environment. What is the issue in relation to Inkosi? I would like us to not just speak about infections in Inkosi or Chief Albert Tutul Hospital only, but the infections generally of the health workers, and as has been spoken by the Premier. The challenge that we are faced with, like we said, is that we are beginning to, as we see the surge, the infection rate of our health workers is also going up. Last week, I think if colleagues would remember, we were asked the same question, and I made a commitment that we were going to have engagements we're going to have a roundtable discussion amongst ourselves and the unions, with presentations that we're going to give to the unions, and the unions contributing. I must say that we are very happy that we did have those engagements this week, and one of the things that we agreed upon together, ourselves and the unions, is the fact that it looks like there is some lack of consciousness and changing the way we are behaving generally as people that are employed by government, and we agreed that there are protocols that we are going to follow. But one of the issues that the unions raised was the fact that it looks like our occupational health and safety committees in the hospitals are not actually active if they are there. Now we decided that we are going to start implementing those as of Monday, and we'll make sure that those are active. The reason why it's important for these OHS committees to be functional is because they are the ones who are going to be walking around, firstly looking at whether management is giving the PPE properly to the staff, but secondly looking at whether the staff itself is utilizing the PPE correctly, including the issues of saying during their lunchtime, during their break time, how do they sit in the common rooms? Do they sit according to the required 2 meters, or do they sit together as it's normally as we have been normally doing? And we believe that is one of the challenges that we have had. We've also started instructing our facilities that in the common rooms, you can, depending on the size of the common rooms, because not all of them are the same size, but if a common room is meant to take 5 workers at a time, they must then now be demarcation that will say only 2 people are going to be in that common room, and where are they going to be seated exactly, so that they don't interact. But that should also include the usage of masks within the common rooms and within the facilities themselves. So we are tightening our issues. We are tightening our implementation protocols. In relation to the infection on Nkosi Albert, I think we can't just make a pronouncement. We are investigating the fact that our numbers are increasing. But a point that we would also want to emphasize is that we must remember that health workers themselves also live in the communities that we live in. So once you start having community transmissions going up and growing, they will also start growing amongst our health workers if the health workers at home don't take care of themselves as they should. So we at this point don't want to be pointing fingers, but we want to make sure that we find the genesis of the problem and we are able to deal with it once and for all. I think those were the 2 issues that were raised. Babmabas.
Yeah, for now, MEC, because they still spending.
Thank you.
No, thanks. I think so that will be easy. I know a number of questions will be going to MEC, so I will answer these questions and summarize in Zulu so that the MEC can then continue to deal with other issues. Firstly, the issue of Santaco, Karinda and Mr. Gog, as you've asked. We are concerned about the statement they issued. However, the matter is also a national challenge. It's a national challenge that Minister Mbalula is dealing with. We have requested MEC Ntuli to interact with the leadership of Santaco in KwaZulu-Natal and try to find a way where they can deal with this issue amicably and find a solution that will help all of us. We are mitigating here quite a challenging environment. On one hand, you've got the business that is collapsing, people losing jobs. On another hand, you've got people losing lives. And we have said that in this week alone, people who lost lives are about 28. And that's not a little number. We must be concerned. So trying to mitigate and find each other will be important. So MEC Nduli is dealing with the matter, and we will take it from there. We are worried about the cases of gender-based violence. We launched our campaign last year, and we will still continue to follow up on the campaign, ensure it's implemented. It goes to all areas as expected. So the work at that level is continuing. All organizations that are fighting gender-based violence should be supported, and as government will be willing to engage with them at any time. And it is because of that reason that we are saying we must use the month of July as Men's Month to ensure that we improve and have a more coordinated approach on the role that men have to play in the fight against gender-based violence. This is a societal problem. It is a family issue. It is a community issue, and we all need to ensure that we work on behavioral change amongst men and amongst boys, and in all areas. We also need to examine the impact of alcohol in relation to gender-based violence. Having said that, hospitality industry, yes, it is coming, it's opening up. We are welcoming that. About 10% of the economy of KwaZulu-Natal is based or dependent on tourism. And therefore, hospitality industry is one of those that are critical. Ours is to ensure that we support all industries to work, but follow regulations as they are. We have interacted, as I've said, we are interacting with all operators in the hospitality industry, emphasizing that they need to follow regulations and protocols as they are. We are going to support them to meet that expectation. But those who will think not to do that, we will have to take decisive actions. Those who will not follow protocols, they will have to be closed. They will have to be confronted. So that's why we are saying, through the Department of Economic Development, Tourism, Environmental Affairs, through Tourism KwaZulu-Natal, through Durban Tourism and other tourism organizations, we must work together with the industry to support them. And while we support them, we expect that they will adhere and cooperate. With regard to cases in government, yes, almost all departments have reported cases. It's only the Department of Community Safety and Liaison, and the Department of Art and Culture that have not registered any case as of now. And when we say community safety and liaison, we don't include SABC because those are part of police. The employees of government who have been infected and tested positive are 457 from almost all departments, and leading is the Department of Health, as health workers are part of the government with 321. So there was a case in the Premier's office, but this should not mean once there is a case, there is a problem and all of that. No. We should support the infected person. We should decontaminate the area where that person was operating. Contact must be screened. and tested if necessary. So there are protocols that are in place. With regard to the issue of schools, yes, there is a problem. We acknowledge the number. But if you will see the number compared to learners that are back and teachers that are back, because all teachers are back to school. So we must understand that. We are expecting that schools will be opening, and additional grades will be coming back on the 6th of July as announced. We are getting ready with the Department of Education having prepared teachers and will be preparing learners who will be coming back and ensure that there is orientation that take place. Teachers have already been orientated. So that's where we are for now, and we'll continue examining issues as we go forward. Maybe on my side, so that we don't we allow the space if questions are toward the MEC. Siyafisa ukuthi si joyine iSouth Africa yonke ekugubheni usuku lwe-Freedom Charter njengoba ngolesihlanu bekuhlangana iminyaka engama-65 kwahlangana i-Congress Alliance eyayiholwa i-ANC kwa-adoptwa i-Freedom Charter eCliptown ngo-1955. Le Freedom Charter yakhanda ukuthi abantu bakithi babumbane bakhulume ngazwilinye ekutheni yini esiyifunayo ngenkululeko yezwe lakithi. Kungakho ke nanamuhla kusamele silwele impilo engcono yabantu bonke noma banguphi indawo. Kungakho futhi kumele sibamsane ukulwa nezinkinga esibhekene nazo, including le nkinga esibhekene nayo yokhuvethe i-coronavirus. Ngalokho siyafuna ukuthi abantu bakithi bonke baqonde ukuthi lokubhebhetheka kwalesi sifo kunqandeka kuphela uma thina sabantu silalela futhi silandela imigomo. Ngokweinamba la KwaZulu-Natal abantu asebethelelekile kusukela kwafa khona icase yokuqala kuze kube manje sebe u-7,789. Abantu sebeshonile bangu-84, kodwa abashone nje kuleli sonto bangu-28. Izifo ezibonakala ihamba phambili ukuthi zibe ingxenye yokutheleleka kwabantu isikakhulukazi ilokhu okubizwa ngehypertension nesifo sikashukela. Ingakho ke sithi kubo bonke abantu kubalekile ukuthi sivikele. Esikubonile futhi kuleli sonto ukuthi kwi-district yaseMgungundlovu izinamba ziyezanyuka khona isikakhulukazi eMsunduze naseMngeni. Nakhona kubalekile ukuthi sigcizelele kubantu bakhona ukuze sikwazi ukuzivikela. Izinamba zizonke zama cases active njengamanje izithi abantu abasabambekile bangu 4,257. Siyazi futhi siyafuna ukuqinisekisa ukuthi iningi labantu ababanjwa lesifo bayarecover, kodwa kumele sigweme ukuthi umuntu atheleleke. Abasebenzi bezempilo nabakahulumeni bebonkana baninga sebethelelekile ngalesi sifo. Ingakho ke kubalekile ukuthi kuona wonke ama-department indlela esiyiphatha ngayo emsebenzini kube indlela ekahle nelandela lemigudu nemigomo ebekiwe. Ngokwe-contact tracing sesikwazile ukuthola abantu abangu 15,437 abama-contact, kanti u-99% walabo sikwazile ukuthola. Ukuscreena sesiscreene abantu abangaphezulu ka-6.7 million KwaZulu-Natal. Siyafuna ukugcizelela ukuthi bekulokho ekuthatheka ngokuthi lesifo sigxile kakhulu emadolobheni, kodwa kuyacaca ukuthi naseyindaweni zasemakhaya sesidlangile kumanje siyabhebhetheka. Siyabona abantu bengahloniphi imigomo ebekwayo, ngoba siyathola ama-report athi bakhona abantu esebenza imicimbi yabo, kube khona abantu ababa nemingcwabo maqede kube nabantu abaningi ababa khona. Konke lokho akukho right ngoba kukhanda izinga lokutheleleka kwabantu linyuke. Ingakho namanje sisagcizelela ukuthi asilandele imigomo ebekiwe. Siyafuna futhi ukuthi sixwayise abantu bakithi ukuthi asiyeke ukuthi umuntu masike seze ukuthi uteste positive mase simxwaya mase kuba nokustigma. Akumele lokho sibe sikwenze, kodwa bonke abantu kumele sazi ukuthi umuntu meke watesta positive kumele anikwe support akwazi ukurecover. Siyazi ukuthi lesifo sibe nomthelelo omkhulu kwezomnotho. Siyabonga ukuthi uMinister umama uNkosazana Dlamini Zuma uyithulile ama-regulations asho ukuthi indawo eziningi nezimboni eziningi zizovulwa isebenze kanjani. KwaZulu-Natal umnotho wakhona ulele kakhulu kwi-tourism. Yingakho sifisa ukugcizelela ukuthi njengoba i-tourism nayo uvulwa kuzobaleka ukuthi abe-industry bayiphathe ngendlela. Siyafuna ukusho ukuthi i-lockdown ibe ne-impact enkulu emnothweni. Sizwile nge-report ethi Edward Hotel okuyihotela elineminyaka eyi-111 likhona la KwaZulu-Natal liyavalwa. Kodwa siyabonga ukuthi abetsohosana bathi bayangenelela ukulithatha over baqhubeke. Siyafisa ukusho ukuthi njengohulumeni siyaqhubeka sixoxisane ne-sector ye-tourism nawo wonke amanye ama-sectors ukubanika i-support efanele. Futhi siyalekelela ukuthi sikwazi ukucoordinator nabeza amabhizinisi ukuthi abantu abafuna ukuthola i-UIF bakwazi uku-applya ngendlela nalabo abafuna ukubhalisela i-National Tourism Relief Program. Kusiphatha kabi ukuthi siyabona ezikoleni ukuthi abayifundi nothisha bayatheleleka. Kodwa siyafuna ukubonga ukuthi noma kunyuka iningi liyarecover, kodwa futhi isibalo siyamanejeka ngoba abantu sebethelelekile ezikoleni nje KwaZulu-Natal bangu-187. Kulo 187 139 wabo othisha mase kuthi u37 kube abafundi. Siyafuna ukugcizelela ukuthi nabo asiqhubeke silandele yonke imigomo ebekiwe ukuvikela ukuthi umuntu angatheleleki. Ingakho ke sithi kukuthina sisonke masibamsane, it is in our hands. Kusezandleni zethu njengabantu bakwaZulu-Natal ukuthi silwisane nokubhebhetheka kwalesifo. Siyosinqoba lesifo ngokuthi sifaka ama-mask uma siye endaweni zomphakathi, siqhubeke nokwenza lokho okuthiwa i-social distancing, ukunikezela igebe phakathi kwakho nomunye umuntu ongenani ngo-1 meter, 1.5 meters. Siwashe izandla ngamanzi nensipho for 20 seconds. Siqinisekise ukuthi sikhava imlomo namakhala uma sikhwehlela. Siyafuna ukugcina ngokugcizelela ukuthi inyanga kaJulayi inyanga yabantu besilisa. Kubalekile ukuthi thina sonke sabantu besilisa silwisane nokubhebhetheka kwesihlava sokuhlukunyezwa kwabantu besifazane. Thina abantu besilisa kumele sithathe indawo yokuba ngabavikeli babantu besifazane, abomama nabantwana. Kumele siqikekele ukuthi futhi siyafundisana, sifundise nabafana ukwazi ukuphatha ngendlela abantu besifazane. Siyabonga.
Thank you very much, Honorable Premier. May I just prioritize the colleagues that have asked online and apologize because they seem to be having a bit of a challenge in our stream, so they are being helped by the broadcasters at the moment. There is a question that is coming from the witness, where the witness wants to know the number, the issue of the ventilators missing, and already they are saying some of the hospitals are reaching full capacity of IEC has been confirmed by some of the doctors. So can the MEC indicate if the province has got enough capacity? They also would like to know, the witness would like to know the current treatment plan being offered for positive patients at ICU. Another question is coming from the Eyewitness News, which is directed to the Premier. It says, Premier of the province, can you respond on this one? The drivers have threatened violence, and the taxi owners will be loading full capacity in violation of the law. Will drivers be arrested and taxis impounded? So there's that question. If we go to another question from the SABC, some of them have been answered. The one that has not been answered is related to, as the department started admitting patients in the quarantine site outside hospitals, are the health workers getting psychological assistance from the department to be able to cope with the pandemic? The others, I think they were answered in terms of the statistics and also the number of health workers affected. These comments from the Mercury, she's asking, she was expecting the MEC for Elche to be here. She's asking, if a restaurant has a capacity to seat 300 people, are they allowed to have 150 guests at a time? She makes an example that 50% of 150 will be, or of 300 will be 150. So there is some confusion around this. Can possibly this question be clarified? I think at the moment, I think it will be those questions.
Thanks. Just to start, I think the question that was directed to me is around the issue of the taxes. As I've indicated, MEC Ntuli is in negotiations and is engaging with the taxi industry. So it will not help us to preempt the outcome of that meeting. Safe to say, ours is to ensure that we assist in resolving their challenge, but also at the same time continue to preserve the protocols that are in place. And therefore, we will not have to, we don't need any confrontation, but instead we need to work together and solve the problem. I think that is the approach we have adopted as government.
No, thank you very much, Mr. Maba. So I think I've responded to the issue of the ICU beds, but I will just probably emphasize a little bit. Are we having a crisis with ICU beds currently? No. Of course, we are beginning to see a surge in the number of patients that we are putting in ICU and the number of patients that are being ventilated. By the way, being in ICU does not automatically mean we are going to be put under ventilation. So we then are managing that. That is why I explained the process earlier on when Karinda was asking about our ICU machines in particular and what we plan to do should we run out of space in the actual ICU wards that we have currently. Has the department started admitting patients in quarantine? Yes. In quarantine sites that are outside of our hospitals, yes. We started with that right at the beginning when we started getting cases that needed isolation, and we then quarantined some patients in those areas, purely on the basis that we also didn't want to congest our hospital beds when you had patients that didn't necessarily needed or didn't necessarily require any clinical attention, but it was just so that they are there for quarantine purposes. So yes, we started utilizing these facilities right earlier on in the epidemic. What regiment is being utilized in ICU? I think that can only be responded to by a clinician that is attending to a particular patient at the time, because that also depends on the nature of the comorbidities that each patient is faced with. So at this point, one can't just at face value respond to that. I think if there's a specific case that question relates to, we should be able to get that case. Thanks.
Thank you very much. Can I check if is there any further question? This other one of the 50% at restaurants.
Oh yeah. You don't want to take the hands first?
Yeah, I'm just reminding the panel of that question. I'm letting you go. Okay. Is there any?
No, okay.
You say. So maybe let me start with you and then Kwame will be last.
As kubukela amabhizinisi aqala sebenza noma economic activities aqala izakale in various areas. I'm just checking that after pretty much where we see where economic development here. We would see, firstly, what are the plans in place to incubate or incubation process, especially of ideas, that business ideas, which are there in the townships, because you may find that government has agencies in the form of Itana, CEDA, CIFA, but the models that they are using are like the financial institutions where you apply but you fail. So what are the incubation process to make it a point that maybe in townships or in rural areas we have satellite offices for these agencies where they could just like incubate the idea and see to that idea, see the light in terms of making it a workable idea, making it feasible, so that at the end of the day, the person who conceived that idea at least can give himself or herself a pat on the shoulder to say, at least I've done something like that. The second one is the history of these areas, the readiness and the capacity in these areas. How are you, what are the plans in place to ensure that when the economic activities are recovering, even the rural areas, the rural areas and the townships are not left behind? And the third one is the issue of project implementers. To say the project implementers sometimes, when they are working, especially in rural areas, they work not through the beneficiaries. Is there any plan maybe to monitor their performance so that in the end of the day, there is like an impact assessment in what they are doing with the beneficiaries in the rural areas and maybe even here in the township? Thank you.
Thank you.
Again, as the province, have you quantified the economic losses due to the COVID-19 and the lockdown? I'm sorry if I missed it last week, but do you have a round of figure as to how much this pandemic has hit KwaZulu-Natal and has cost the economy?
Thank you. Hand over to
No. No, thanks once again. I think the issues of incubation and the history in townships is the work that the department is doing, the Department of Economic Development. And that is the work that the government have been doing even before COVID-19. And I think there is a program that take the entities to rural areas, but also to township. So there is that program, and I know that some of the entities are already operating in townships. Itala, for instance, it's one of those that are operating in our townships. So I think it will be the matter of connecting and ensuring that there is a link created. we will be also looking on the issue of how to monitor project implementers. And the monitoring, it's one of the things that we have prioritized as the state, especially during this fifth administration. With regard to the issue of economic assessment, we have not done a comprehensive assessment. But last week we did report that we estimate that so far we will be down by 30 billion rands, which will be a huge amount impacting on the economy. With regard to the issue of
All right, apologies for cutting out of this briefing by the KZN Premier Sihle Zikala. There is currently another briefing that we're taking you to, which is also quite important. The Santako